rest. They still have a pulse and there's no trauma. So you're not worried about spinal injuries and you're not worried about CPR because they still have a pulse. You're just worried about managing the airway of a patient who stops breathing completely. Okay? So again, first step, BSI. Second step, establish an open airway manually. Do a head tilt chin lift. Don't forget this is always your first way of opening the airway, right? Say your partner's 10 seconds behind you with the equipment. Until you have the equipment, you're going to just start with opening the airway with a head tilt chin lift. Once you've got your equipment, forgot that I needed this. I'm going to insert an appropriate size airway, and then I'm going to grab this BBM and immediately start ventilating. All right? So the goal here and the fail criteria is first breath is not within 30 seconds. So from the time they tell you go and they start the scale, you have to say BSI, open the airway, stick in an OPA, get a mask seal, and squeeze that and get the first lung rise within 30 seconds. So we time it until we see the lungs rise for the first time. Okay? You guys can do this in less than 10. Seriously, you'll practice. We had a contest last class. One guy did it in 7 seconds his first try. You know, you don't have to rush. Like this is not a, you just, as long as you calmly do what you're trying to do and know what you're doing, it doesn't take long. Don't stop to verbalize a lot. Don't stop to say like, okay, I'm going to check this from one technique, corner of the mouth to the angle jaw, other one. Like, don't give me a 30-second explanation of how to size the airway. Because I just saw you do this correctly on the other skill like 10 seconds ago. So this time, just grab it and just put it straight in. So start ventilating. And then now what we want you to do is either ventilate for a little while on room air, or I don't care at what point in this you attach to oxygen, but clearly you want to attach to oxygen at some point. The reason we have this skill split up, you know, I understand in real life many times the first breath you deliver, you're just going to deliver attached to oxygen. That's fine. I have no problem you attaching the oxygen in those first 30 seconds before you deliver the first breath. It's just that sometimes you won't have the oxygen right there, and we don't want you to delay doing ventilation just because you don't have oxygen. Because the 21% oxygen in room air is still helpful. So be in the habit of knowing that it's still beneficial to ventilate on room air, but as soon as you have an oxygen tank available to you, you should. So oxygen tubing, this will still all be set up because you're going to do these skills one after another after another. I'm not going to go back through putting it together, but this is, imagine this is still on the tank. You're going to have left the reservoir connected from when you did that piece of the skill, and then you're just attaching the oxygen tubing from here to here. And in real life, mostly these BVMs come with a tube attached already. So all you're doing is plugging the other end in to the regulator, which is on the tank here.
And should we give it a second for the kind of the reservoir over here to fill up, or it doesn't
matter
anyways?
It just, I mean, who cares if one breath is the room air that was in the tube? Mm-hmm. The next breath will be oxygen. Okay. So that doesn't matter. So what we want to see you do is ventilate for at least 30 seconds, doing a rate of what? One breath every how many seconds? 5 to 6 seconds. So if you need to write this on there, right above, note examiner must observe proper ventilation for 30 seconds. What that means is I want to see you ventilate one breath every 5 to 6 seconds, because that turns out to be a rate of 10 to 12 per minute. Okay? At some point the oxygen gets attached, and again, just reiterating, I don't care if I see you ventilate for 30 seconds after it's attached to oxygen or before it's attached to oxygen, but one or the other I want to see you do 30 seconds, so that's 5 or 6 breaths of good good rate, good tidal volume, you know, watching for chest rise. So let's talk about rate a little. If I do this, is that enough? If I do this, is that too much? Right. So we're going for just until the chest rises. So it's usually, if you take 2 fingers and squeeze the bag with 2 fingers, that's a pretty reasonable volume probably for most adults. It's not fair that you get to literally see his lung. You know, most patients have like skin, you know, maybe even clothes. So it's kind of better to actually practice this on the other mannequin head, which is a CPR mannequin that has skin instead of bare lungs. But just get in the habit of really paying attention. As soon as you start to see the lungs inflate and the chest rise, that's enough air, and don't overventilate. Because think about this, when you're attached to 100% oxygen, that's 5 times as much oxygen as normal breathing. There's a sense in which you could have a smaller tidal volume and still be delivering just as much oxygen to the cells. So I don't want you to underventilate, but just keep in mind that our tendency is always to deliver more oxygen when we need to. So like consciously rein yourself back in, because every time you deliver too much too much air, it's going into the stomach. And so as that builds up over time, the stomach gets bigger and bigger and bigger. Number A, you're likely to cause the patient to vomit. And now, oh crap, I got
even with an OPA in there?
Yeah, OPA won't prevent vomiting.
Right, but it won't it prevent air from going into the esophagus?
No, I mean if you overventilate, if you push more air in than will fit in the lungs, the only other place it can go is in the stomach.
Okay.
So you're probably delivering a little bit of air in the stomach every time. The idea is to minimize that rather than deliver a lot every time. Because as the stomach blows up more and more and more, there's pressure in there, they're going to vomit. And now I have to get the suction out, I have to suction. It's gross. I've interrupted oxygen delivery to my patient. You know, all sorts of bad things happen. I have to decontaminate the ambulance, it might smell horrible, like, you know, whatever. Ranging from actual serious patient concerns of hypoxia and the risk of aspiration and choking to just personal, you know, you not having a bad day because you got covered in puke. All of these things are detrimental, not to mention the fact that as the stomach gets more and more and more full of air, it actually puts pressure on the diaphragm, and it increases the interthoracic pressure, so it makes it harder for your heart to beat effectively, and it makes it harder for the lungs to expand fully. So it makes everything work worse when the stomach is overly inflated. So just really be conscious of not overinflating when you do this. And I think that's really pretty much it. Questions about this skill sheet?